morning, good afternoon, good evening from wherever you're watching us across the globe. Also, depending on what time you get to watch us. Of course, we are coming to you live from Switch TV studios in South Sea. And today is a little bit different because this is our first live since we joined the digital space. So, of course, just sit down, take a seat because we have a lot lined up for you. My name is Nana Oniti.
And yes, it's not your regular Thursday show because today, like Nana said, we are coming to you live on YouTube and Facebook, and not just to have our kawaida conversation. Today is heavyweight kind of conversation. We are talking matters that you and your loved ones need to sit down, relax, take notes, and probably this conversation will change your life. Karibuni sana to Chatspot. Nana, uko salama?
Niko salama kabisa. I'm still looking forward to what we are supposed to be doing today because we are about to mark the World Contraception Day, which happens on the 26th of September every year. I know you didn't know about that probably. So note, every 26th September of every year since 2007 is when we get to celebrate and, of course, not just create awareness around family planning and contraception, but also amplify so that our youth, of course, I don't know if you guys did ever had any sex education, especially where charity should begin at home. We are so embarrassed on talking to our kids, our teens about contraception that we are missing the mark because if, as a child, I feel like when you're growing up, you are a blank page, yeah? Mm-hmm. So if you don't feed me with the right information, the world will definitely do its part and feed me with whatever information, whether good or bad. So I feel like as charity begins at home, this is a conversation where we need to definitely sit down, create awareness, and also tell the youth, listen, just make informed choices on what contraception, what to use, you know, and of course safely.
Yes. Yeah. And, you know, to have this conversation in depth with us today, we have two representatives from Mary Stops. We have Josiah and Doreen. Karibuni sana to Chatspot. Usually we have a table over here, but then we changed things up a bit to see mekuja mkikaa vizuri kila mtu aone. And, you know, it's a very, like Nana said, it's a very important conversation to have. And this just takes me back to a conversation we had on Chatspot on Thursday.
Yes.
That was yesterday. Yeah. And it was all about sex and how these conversations, we were terrified to have them with our parents. Mm-hmm. So whatever we were taught in school, hiyo ndio kitu ilikuwa happen. Na kwa TVs, they were not talking about these things as much as we are doing right now. So we are on the right path. And just before we get into the nitty-gritties of why we're here today, maybe kindly introduce yourself. Of course, ladies first.
Yeah.
I'm Doreen Meme. I'm a registered nurse. I'm currently based at Samia Park Premier Center. It's a newly opened facility, an ultra-modern facility that offers women health. We also offer men services. We offer child health. So everything about a woman, everything about our families, when you walk into our facilities, you will get the right information, you get the right services, and of course offered by passionate service providers.
Absolutely. Yeah. Thank you so much, Josiah.
Thank you, viewers. Thank you, everyone from wherever you're tuned in. My name is Josiah Mwandaza. I represent Mary Stops Kenya. As you've heard, I stand for quality. So my biggest role is to ensure that the services that we do offer across all the channels are of good quality. So thank you guys for having us here. Why? Because we are here to debunk all the myths and inform the public in matters relating to sexual reproductive health. Thank you very much.
Yes.
Absolutely.
Yeah. And our hashtag today is Cheza Smart. That's the first hashtag. Then we have Choose Lifeguard Condom. And of course, the last one, World Contraception Day 2022. So please chime in on Facebook, Palechini. Please contribute to a conversation that we are about to have. So guys, tunawa welcome. Sit down. Welcome. And if you're a parent, especially a millennial one, please let's change the narrative. That didn't happen with us. So please let's do better and take that seat. Don't shy off. Let your teenagers sit down because they need to hear. If they don't, they will be taught by the world. Wacha turudi tu.
Ukweli. Na pia unaweza tuma SMS 111 all the questions you have when it comes to, you know, sexual health, when it comes to contraception, we will be having those questions answered here. Yeah. And before we get to contraception, maybe you can just tell us a little bit about Mary Stops, what it stands for, what it is about, before we get into contraceptions. Anyone can go.
Okay. Thank you, ladies and gentlemen. Allow me now to introduce what Mary Stops is all about. So Mary Stops International is an NGO, a non-governmental organization that operates in over 37 country programs. And here in Kenya, we opened our doors in the year 1985.
Whoa.
And we operate through various channels to include the outreach, where we visit basically the Ministry of Health facilities through the in-reach and outreach programs. We also offer our services through our mushroom clinics. We have 14 in number, distributed all over the country. Maybe just to be more precise, we have 11 clinics and 2 nursing homes for a good name for the public. And we also have a CMOC facility where we offer all high-end services. So we also have another channel, we call it the social franchise, where we partnered with private facilities so that we can extend and expand access to help, you know, women and men across the nation. And we also have what we call commercial sales, where we do issue and distribute products basically that address the issues under sexual reproductive health. So we believe in a mission that every birth should be wanted. And having said that, our mission is children by choice and not by chance.
Oh, wow.
That's beautiful.
That is very beautiful. So whatever it is that you thought about Mary Stops, I hope you understand. If you've never heard about it before, now you understand what it stands for and what it is about. Do we get into this, Nana?
Absolutely.
Let's do it.
So, of course, let's just start with of course, there are people who don't know what contraception is or what contraceptive is, and of course, the different types. Maybe, Doreen, you could go ahead and tell us.
Yeah, so maybe if I would want to let people know more about contraceptive, this is a method or a procedure that is performed on a person's body, either the man or the woman, to alter the process of conception.
Okay.
So we can have drugs, we can have devices, or minor procedures such as the vasectomy or the tubal ligation. All these in an attempt to help the woman and the man plan their families.
Yeah.
It is also important to note that the contraceptives are advised to anyone who is having sex, all the way from the teenagers all the way to the women, as long as you're within the reproductive age bracket,
which is
between 15 and 45.
So you can't give contraception or contraceptive to any 14-year-old. Is there an age limit where as a 14-year-old they could be married? Because we know our cultural differences, and there are people who get married way younger. So can you give contraceptive to a 14-year-old?
Yes, you can.
Okay.
There is an adolescent sexual reproductive policy that has been put in place so that we can be able to allow these young ladies to be able to access contraception, because as a matter of fact they are already having sex.
Yeah.
We've seen mothers who are as young as even 12 years, 11 years.
That's true.
So we cannot be blind about the fact that they are having
it's
sex.
happening.
Yeah, it's only that in our African setting we've been made to think or blind ourselves that these are children and they should not be engaging on in sex. So we have to give the education part of it, let the parents be involved in their child growing so that they can be able to discuss sex with their children and be able to let them make the right choices. Yeah, so it's all about education, making these services available for the teenagers, even for the married, for the college going students, so that they can be able to achieve their dreams without interruption, maybe due to motherhood. So it's something that should be made available to everyone here.
I love that it starts with education, and you say that because like we were I think we were preempting this conversation. I think we were preempting this conversation because we went deep into how some kids are just dragged and amedungwa kisindano, you do not know why, but the mother is protecting you from having children, probably because she went through the same and she doesn't want you to do that. But then I love the fact that you are very insistent on the education beat of it. So this education, where does it happen? And who gives it? I know we are doing it now, but where ideally, from where you come from, should it start from?
Thank you. Again, allow me to revisit the definition of contraception from a layman's perspective and also a scientific perspective. So basically it is the intentional prevention of conception. You do it when you feel like. And why will you do it? It's because you have the capacity to make that informed decision. So from where I see it, decision making is not about the age. It is more important about the capacity. And that is why we have someone who is over 30 years, and maybe because of another reason or the other, they're not in the position to make that decision, then it won't be an informed choice. So that intentional prevention of conception using either devices or surgical procedures or maybe chemicals or drugs to prevent conception is what we now term it as contraception. So when it comes to now the education, we have various channels, as earlier mentioned. So we really are so much into the youth, and again, all the age groups. Why? Because as we speak, the world has become an extreme sport. I think we can all agree to that.
And in Nairobi, they call it one big bedroom. Yeah, I understand.
So when a client walks in our facility, in any channel, we don't just go ahead and provide the service. They normally go through a number of checks. Are they being coerced? Especially with this now, the youthful or rather the young generation. You know, sometimes we all know about the wababas, etc. So if a young girl walks in our facility, we need to have an honest conversation with that as a client. If we now quantify that the person she is with is rightfully the partner or the husband, then we can have them both. But we need to understand that this young child is not being coaxed, and then we have an honest conversation on one-on-one to rule out other many things.
Wow. I love the fact that he mentioned that, you know, you come with your partner and then we can make this decision together. Growing up in the village back in the day, what used to happen is I'd see my auntie say, "Nenda toton wasingano." You know, like that. I would always wonder, why are you going to be injected and you're not even sick? You know, and that was, I think that role was deeply for the women. The men were not as actively invested in family planning as we are seeing now. How is it now? What's the difference between family planning then and now?
Yeah, I believe it is a woman's right to pursue family planning or contraception. But again, from another perspective, I mean, it calls for both of them.
That's true.
If we need to talk about maybe sexual reproductive health. So going forward, I think it's prudent enough to involve the male. And in this case, there is an increase in appetite of now men accompanying their women. In not only Mary Stops Kenya, but across other health facilities, whenever they are in quest to learn or rather choose their best method of contraception. So it is now on the rise.
We like it.
Why? Because
we are here for it.
We are here for it. We love to see it. But as you talk about contraception, maybe, Doreen, you can break it down for us. What are the different kinds that they are there, like in detail, to jue hii inafanya, hii haifanyi, you know, people just do it because.
And what are the limitations?
And the limitations, as well? Because me here uko kwa makeup room na saying, "Oh, najua mimi," so mimi just go get it without knowing why she's getting it. Is it working for me? Will it work for me or not? Maybe you can just break it down for us.
So when you talk about contraceptive, we have a wide range of contraceptive methods. And all these methods are classified based on the duration how they work, what they release into the body.
Okay.
So we have the short-term methods, we have the long-term methods, and we have the permanent methods. So when I talk about short-term methods, these are things that you need to take on a regular basis, or you need to be very keen on a daily basis. We have the male and female condoms that you have to use every time that you have sex. Of importance to note that the condoms are the only methods that offer protection against STIs.
Yeah.
So we're also advocating, in conjunction with all other methods, let people use contraceptives with condoms. We have people having polygamous marriages. We have people having mipango ya kando, tuko na wababa. So we are always encouraging anybody who is sexually active, do not turn a blind eye on the fact that they are STIs. We need to use condoms.
Yeah.
So we have also the daily pill that is taken on a daily basis, which releases a hormone in the body to stop ovulation. Ovulation is that process of releasing an egg that can be fertilized by the sperm. So if you don't ovulate, definitely you won't get pregnant. So that's how they work, but you have to be very keen. You have to have an alarm clock. So there is a limitation to that, because the failure rate can be quite high when you're using the daily pill. We also have the 3-month injection that is given every 3 months or every 12 weeks. So you have to visit a facility every 3 months to get the injection. It also releases a chemical, or the hormone, to stop also ovulation. So if you don't ovulate, definitely you can't get pregnant. Okay. So with the 3-month injection, prolonged use has been associated with delayed return to fertility, of which people have misinterpreted it to infertility.
Okay.
So it actually does not cause infertility, it only delays the return.
So when you stop the 3-month injection, it might take a bit if you want to conceive.
Yeah, even 3 to 6 months, or even a year to some people.
Okay.
Yeah.
Okay.
So for the short-term methods, the effectiveness are quite lower compared to the long-term reversible contraceptives.
Okay. Which are the long ones?
So the long-term reversible are the implants and the intrauterine devices, the IUCDs, or the coil, yenye watu wanaita coil.
The
Kopati. Yeah. So with the implants, there are rods that are placed under the arm. We have a 3-year one and a 5-year one. So they are reversible, means that when you want to get pregnant, you can always remove the device even before the time has elapsed, and you can always return to fertility. They also release a hormone that stops ovulation. So definitely if you don't ovulate, you can't get pregnant. So the commonest side effects of the hormonal contraceptives, either the injection, the implant, or the pills, is irregular menstruation, because of the hormone that they release. They make the uterus go like into a dormancy state. So some people may stop having their periods. So which has been interpreted by some people out there that periods itakwamilia hapo.
Yes.
Okay.
So it's not that itakwamilia.
Itakwamilia.
Yeah. So when we get our periods, it's because the inner wall of the uterus thickens. When we don't get pregnant, we shed. So when we have these contraceptives in us, when it is releasing that hormone, so the uterine wall is usually thinned throughout. So it manifests as absence of menses, or the irregular periods that come slightly, like spotting, or every 3 months, depends. But it also depends with the individual. There are some people will have the implant and still get their normal monthly periods. So when we talk about contraceptive, your experience cannot be the same as mine, same as Mwikali's. If the implant worked for you, it may not work for me. So that's why we advise people to go to health facilities, come to our Maristop facilities. We have well-trained and capacity-built nurses and clinic officers and doctors who are there with the right information. You will be taken through various eligibility criteria, because there is something that maybe you have within your body that prevent you from using an implant, but you're eligible for another method. So we always encourage that. So with the IUCDs, we have two types, the hormonal one and the non-hormonal. The one that people call Copper T. And people have branded that Copper T is the best method.
Most people, it has a good CV out here.
It has a good CV, which is a good thing. But we usually say there is no best method.
Okay.
It's best when it works for you.
Yeah, when it works for you. And you can't know what will work for you until you use it.
That's true.
Or try it. So at least if you have the right information and you know the possible side effects that come along with these contraceptives, you will be able to make a right choice. So if you use an implant and I never told you about the possibility of you not having menses, definitely you will be shocked. You will feel that this thing is not working for you. It might even give me a condition. People say that it will make you get cancer. Those are the myths that are out there. But with the right information, right screening, you'll be able to get something that can work for you. Then again, if it doesn't work for you, there is always an option of removing and trying another method.
Then there are permanent ones.
Yes, like the vasectomy, which has a low uptake in our African setting.
We have a gentleman here. Maybe he can explain more about that. Please.
Thank you again. Allow me to make the public understand our capacity statement that last year alone as Maristops, we reached out to over 1,495,000 women out there who were using a method of family planning courtesy of Maristops Kenya from the various channels that I talked about. But that is to say we take lead when it comes to sexual reproductive health. And I would like to ask the youth who are listening, who are tuned in, the parents, keep those questions coming. Why? Because today you have the experts.
Absolutely.
So allow me now to break it down and make all understand that she talked about the pills. The everyday pill. She talked about the short-term methods, basically the injectables and again the pills, but the pills the everyday, while the injectable, we can have the one for 1 month, we can have the one for 2 months, and we have the one for 3 months. And one that is readily available is the one for 3 months, and that's why we talk about Sayana or Depo. So we have the long-acting but reversible. And she rightly talked about the implants. Those are flexible rods put in the inner side of the upper.
I have a question. Why do they put it there?
I'll come to that. I'll come to that. Then she again talked about the intrauterine contraceptive devices. On the implants, we have the ones for 3 years, and we have the ones for 5 years. And then she talked about the IUCDs, that is the intrauterine contraceptive devices. She divided them into two, that is the hormonal and the non-hormonal.
Absolutely.
So the non-hormonal, we have the ones for 5 years, we have the ones for 10 years. And the one that is readily available in the market is the common Copper T. And then we have the hormonal now. So the hormonal one, I would like to make the public understand that the hormonal methods, be it the pills, be it the injectables, be it the implants, or the intrauterine hormonal devices, their mode of action is basically threefold. Threefold in the sense that, number one, it could either make the cervical mucus thick in a manner that, for lack of better word, the sperm will not be in a position to meet the egg. That is one. Number two, it can make ovulation, the release of the egg, mature egg, from meeting the sperm less likely. Why does it do so? It suppresses it so it doesn't get to its maturity. Then number three, she rightly talked about thinning of the inner layer of the uterus, where the attachment or the implantation of the fetus or the baby takes place. So these hormonal methods have their own way of making that area thin and less favorable for that attachment.
Okay.
Yeah. And then she talked about the permanent methods.
Yes.
That when we do it, especially here in Africa, the success rate, allow me to revisit the implants and the IUCDs, if inserted correctly by competent providers, then the success rate of the long-acting reversible methods is over 99% effective. Same as now the permanent method.
I like the disclaimer though, because
at 99 point, it's not 100.
By a professional.
Yes. So permanent methods, that is now the vasectomy and the tubal ligation.
Yes.
Again, they have various advantages, and I would like to say again, almost all women and men are eligible for all these methods.
Yes.
But as she rightfully said, once you visit us or any other health sector, they'll go through the medical eligibility criteria to see if yes, you are eligible for this method or not.
I actually didn't know there's a difference between like different types of vasectomy. I just knew vasectomy is just, you know, cutting the tubes and that's it.
Tubal is for the woman?
No, so
even vasectomy has types.
So we have bilateral tubal ligation. That is for the female, and we also have vasectomy.
Yes.
That is now for the men. So what is vasectomy? Because that is what you asked. And she again rightly mentioned that the uptake is
very low.
But I mentioned earlier on that men are coming up.
Yes.
Men are coming up.
Yeah.
I believe we all understand that it is irreversible.
Yeah.
But basically in those advanced countries, maybe they can do whatever it takes. But again, the success rate to reverse is again, the chances are still very minimal.
Very low.
But in our setup here, once we do it,
that's done.
So vasectomy, basically we aim at identifying those tubes that transport the sperms from where they are stored, from coming out through the urethra to the birth canal to find the eggs.
Okay.
So those tubes in men, we call them vas deferens.
Vas deferens.
So we identify them, tie them and cut
them.
So there are two approaches to do that. So number one, we can use the incision type, where you go through the sac, that is the scrotum, you identify those tubes, then tie and cut. The other approach, we call it the non-scalpel.
Okay.
We have advanced equipments or the instrument that can just puncture and go straight to those tubes. And then we identify them, we retrieve them, we tie them and cut.
Yeah.
So regardless of the method, the success rate is more or less the same.
The same.
Yeah.
Okay.
Kuna moja sijasikia.
Gani?
Pull and pray. You know, because there's so many people.
And we actually have a question on that because we would like to hear about that. Iko kwa category gani?
Especially when addressing the youth, I'll be addressing them with a lot of conviction. Why? Because I hope you are referring to
withdrawal.
Yes. So on that note, just hold right there, because this is a very important, mostly asked, thank you Nana, mostly asked question about, you know, withdrawal, and it has many names around them. But if you have any questions on that, 111-444-111, we're going to take a very short break, but then on this break we're going to delve deeper on what Maristop does. So this is a video taking you to that place. Take a look.
Welcome to Maristop, where we offer comprehensive reproductive health services, and it's tailored all for you. Some of the services that we offer in Maristop's:
general health consultation, laboratory and pharmaceutical services. We also offer ultrasound services, family planning to include short-term, long-term and permanent methods of family planning. We are also offering cervical cancer screening, also offering STI screening and treatment. Pregnancy crisis counseling services are also available.
So through our able team, once a client visits our facility, Their first encounter is our reception. Then from there you are guided to our waiting area, where now you wait for our doctors to call you in. Once after consultation, depending on the type of service that you came for as a client, you are referred to various diagnostic departments.
Our laboratory department is fully equipped with the hematology machine, microscope, we have biochemistry, pharmacy is fully equipped with all the medications that may be necessary, antibiotics, pain relief, and any other medication that may be necessary is available. We have a recovery room with a 3-bed capacity. So in case a client needs to recover for a day or so, we are able to accommodate them there with enough privacy and comfort. With a bit of sound system in case a client needs to relax and listen to music, it's available.
All this comprehensive service, we discover that our clients wants to get everything in one room. Our clients are happy because we treat them like they are home. As you see, our clinic is really demedicalized in a way that we make it look like home. We don't want you to feel like you're in a hospital the moment you come in.
Welcome back, and if you just joined, umehata kiasi, but ni sawa tu. Let me sample just a few of your feedback from our YouTube live. Kuna moja anaitwa Uncommon sana anasema tuned from Turkana, Lodwa, shout out please, ndio hiyo shout out yako. But then there's someone who says great conversation, very very insightful. That's Rebecca Nyambura. Then we have George Mbugwa. Yes, the men's are coming in. We love to see it. Anasema great discussion, information is power and myths demystified. Love it. Kuna mwenye akona swali hapa, so I'll let of course one of our professionals there tackle that. Anaitwa Irene Moli. Hi Chatspot, nilieka coil last year May na tangu niekwe sijaipata period hadi leo, na kabla nieke nilikuwa napata periods every month. Niko na mtoi wa 18 months, please help. And then Wilfrida Kadenya anasema very productive discussion. Leonida, with you through it all. Thank you so much for joining us. And on Facebook, we will sample just also a few, so kindly chime in with your questions. We want to answer that. Let me throw it back to Mwikali.
Great. So do we answer this question now, or do we wait for it?
We could.
Please, let's just answer it so that we don't forget about it.
Yes.
So Irene ameuliza aliweka coil
last year. Hajapata wait.
Hajaipata.
Jesus. Period.
So kuweka coil na kukosa period it depends with the type of IUD. So the copper T, we usually say you should not miss your periods. You've heard about the 99% effectiveness.
Yes.
So she could be in the 1%. You could have conceived if it is the copper T, or you could be having hormonal imbalance, which is causing you to have, you've missed your periods, or probably she was given the hormonal IUD. The most common side effect of the hormonal IUD, remember, it is releasing a hormone that thins the uterine wall. So it works more or the same like the implant. So they miss periods with the hormonal IUD. So maybe probably she could go back to the facility where she had the method, get checked, rule out pregnancy, rule out hormonal imbalance, or know the specific type that she was given.
Allow me to add this, that at Maristops, it's not about just the service provision. We go a long way to empower the client to understand and have a chance to ask all her questions. And I think that is an area that maybe the client who raised that question, that session didn't come out clear. Why? Because ideally after the insertion, the client is advised to go back for checkup. We discourage self-check. And it's not only Maristop, we are talking about one world, one standard, and whatever we do, it is in support with the WHO and the mother ministry. So immediately after the insertion, after 1 month, the client ought to have gone for a checkup, and then she stays for 3 months, goes back for a checkup, then she stays for 6 months, and then once every year.
Interesting.
And so I am afraid that she could be pregnant because that device was inserted in the month of May, and we are now in September. I understand that she could be still breastfeeding, but the kid is 18 months.
18 months, yeah.
So as of now, I am sure maybe the child is taking other meals, so there's a higher chance that maybe her periods should have come back to normalcy.
Okay.
But again, it could be hormonal imbalances.
Tusiseme hi junior.
Say it.
Salimia junior.
So going back to the question that Nana asked just before we went on the break, about pull and pray.
Yeah.
And hapo ndo tuliwachia, and I think ulikuwa unajaribu kutuelezea.
Yeah, let me just introduce it because
Yes.
my colleague will pick it up.
Okay.
With all due respect, we all know that it happens inside
Yeah.
the ladies. So maybe she will pick it up and tell us more about it. But back to your question. Back to your
Did you
question.
miss it?
Okay, cool, fantastic. I'll just wait. I'll wait for
So
Doreen. Okay.
we skipped the natural methods
Okay.
for various reasons. Why? Because if we are addressing the youth, then let them know that we have the lactational amenorrhea method, whereby if a woman has given birth and she's doing exclusive breastfeeding, then there's a higher chance that within the first 6 months of exclusive breastfeeding, the woman may not see her menses. Why? Because the hormones responsible for producing and ejection of milk do the opposite with those at the reproductive site, responsible now for the menses.
Okay.
I think that is clear.
Yeah.
So that is a lactational amenorrhea method for those who are doing
Lactating,
exclusive
breastfeeding.
Then we have the withdrawal method.
That I just learned is called pull and pray.
Yeah.
Like, wow.
You're welcome.
Thank you.
Yeah, so there are various types. With all respect to our viewers, I understand it is given a specific name depending on the site where it's done.
Oh,
Okay.
okay.
Now you get it. So for example, based on
I'm
your
waiting.
faith, and apologies to the viewers because maybe some of the content that we may discuss here may not be good enough, but it is believed that if it's done somewhere else apart from the birth canal, it is given a different name.
Okay.
So with the withdrawal, basically now we take it straight to, the common one, that is through the birth canal, so the in-out, but just before the man ejaculates, he withdraws himself from the lady before the ejaculation takes place. So why is it discouraged with our youth? It is because during what we call the foreplay, the romance that they do preparing each other, ideally under the urethra of the man, now there is some fluid that comes out to cleanse the urethra, because we all know that the urine is somehow maybe at a different pH level. So there is a certain fluid that comes out to cleanse the urethra, number one. Number two, there's another fluid that normally accompanies the seeds of the man, basically to serve as food to that long journey it will embark on. So during these preparations, I would like to tell our viewers and the youth that there's a higher possibility that some of that fluid could have the seeds. So in a lack of better word, men can come before they actually come.
Is it like pre-cum?
Yeah.
The pre-cum now.
Okay.
Exactly.
Ooh. I want to give you your flowers by the way before because nimeona wanyamaza. Kuna mtu hapa anasema anakuwa congratulate sana for this discussion. Doreen and Josiah are making such great and valid points. It's refreshing to listen to such talented professionals.
Thank
okay,
you.
now you can go on. A break kidogo, Doreen.
So with the withdrawal method,
Yeah.
pull and pray. It's pull and pray because it is 50-50.
Yes.
It can or cannot work.
Yeah.
Yes.
So it only works if probably you didn't have sex before, you didn't romance, mulingia tu kwa bed, chap, chap, chap. Yeah. But then again, when a man ejaculates, at that point, ni kama systems zote zinakuanga zimesimama.
All systems go. It's not.
They must have that experience or the expertise to be able to withdraw before they come.
The timeliness.
The timeliness.
Yes.
Okay.
Yes.
And then again, after they withdraw, maybe sasa mulikuwa tu ni round moja na ni hivyo. Because in the next, after,
Bado.
yeah, so there's that residue of sperms that may have been left. So in your next intercourse, probably
Ndo
zitaingia
zinatoka
hata
kwanza.
before hata ukam. So it's a 50-50 kind of
50-50.
thing.
Okay.
Yeah.
Okay.
Yeah.
And I hope you've been following this conversation, because other than just impacting you with knowledge today, we are also hitting you left, right, center with some giveaways. And all you have to do is tell us at least 3 of the contraception methods that we have talked about on the show. Do it on the comment section. Send it to 111-444-111. That is our SMS line. 3, at least 3 contraception methods that we have spoken about. If you go in depth, the more in depth your answer is, kama vile tumepatiwa hapa na our guest, the more your chances of you walking away with a beautiful gift hamper courtesy of Maristop. So keep it locked.
Yeah, I have a question.
Yes, please.
I actually do have a question. When it comes to vasectomy, you said somehow izo nini azitatoka. So I'm thinking, is there cum when
do they ejaculate?
Do they ejaculate after vasectomy?
Okay. So thank you. Allow me to address again the youth when it comes to withdrawal, because this is something that is serious and it's messing a lot of the youth that we have around. Withdrawal calls for enthusiastic cooperation between the lady
Enthusiastic
and
cooperation.
the man.
Josiah.
Yes. Okay.
Why am I saying this?
Yes.
From where I come from, it will be very difficult for me to be allowed to come out at that stage.
Yeah.
I hope you understand what I mean.
I understand.
Yeah, from where I come from.
Yeah.
And again, it depends with the style.
The position.
The position, yeah.
Okay.
Because, for example, if the man is the one who is lying down and the lady is at the top, how will he withdraw?
So the woman is now doing the withdrawal anyway.
So I checked if there is that enthusiastic cooperation between the two, the effectiveness, they still say it is less than 75%. So that 25% is a higher risk.
Very high.
So back to your vasectomy
question.
Yes, we do understand that ideally there are 2 fluids that accompany the male seeds, and I talked about the seminal fluid and the prostatic fluid.
Okay.
Yeah? So those 2 fluids, one serves as a cleansing to, the passage, because the pH levels are different.
Yes.
So it cleanses up and it makes it more favorable now for the male seeds to pass through. Then the other fluid basically acts like food. So what we tied are the tubes from where the seeds are being stored, but the 2 other glands, that is the seminal gland and the prostate gland, those ones are elsewhere. So that fluid will still come, but without the seeds.
The seeds.
Okay.
And in for lack of better word, the young men call it
100%.
Rubber bullets. They can
You're calling it something else, Doreen.
0% seeds, 100% juice.
Okay. And then rubber bullets.
So I would like to say, if we have adults who are watching, there is also what we call dry orgasm in adult men. If you have done intercourse for quite a while, many times, it reaches a point that, yes, you reach your orgasm, but nothing comes out. We call that dry orgasm.
See the way we are all quiet. I'm like, what? So they achieve the same.
Exactly.
The
Everything
same feeling,
is okay.
the same experience.
Yes, but nothing is coming out.
Nothing is coming out.
Yes.
Okay.
Is that even achievable?
so at what age is it for the young ones or the older ones, like you mentioned?
Is
there an age to that?
Ideally, sperms are being manufactured on a daily basis.
Yes.
And it takes like 3 months for the sperms to reach maturity.
Okay.
So we say the more you do it, the better. But again, with age, it reaches a point that the more you release, at some point, you will not be in a capacity to, you do it, but nothing comes out. But yes, you've reached your orgasm. But the beauty about the vasectomy remains that it is only the seeds that are absent, but the other fluids
Come out.
come out.
So that's why there's the question of the sperm count.
Yeah.
Where does that?
Yes.
Yes.
So let me just go further. Maybe you will add on to that. So if we do the vasectomy, ideally we ensure that there are no more sperms in those tubes after the cut. Why? Because there are those who are normally in that tube ready to be released. So earlier on we used to talk about 21 ejaculations to ensure that everything has come out. But the proof to that is doing semen analysis. So you have to go to the lab, and then we give you maybe like a pot. You produce the fluid that is the sperm, and then we check through the lab whether we do still have those seeds.
Going on. Is it painful
for the men? Not painful. Why would it be painful?
Just a question. I don't know, like the procedure.
I'm sure they have those.
Okay, so no, I was thinking maybe she was asking whether it is painful to get
the liquid.
The specimen.
No, of course.
Same procedure.
From where I sit, I think it is more easier to do a vasectomy than a tubal ligation, because a tubal ligation is an incision in between the navel, that is the umbilicus, and the symphysis pubis. At that distance there, at the center, we make that incision and identify those tubes from either side of the uterus.
Okay, so it's the healing process even for the woman is...
But for the vasectomy, you just approach it from the sac, the scrotum, for lack of better word. So yes, we do consider pain management, and again I repeat, quality service is not only when the service is successful. That is not the only marker. We check in other variables to ensure that the service was of good quality, to include now the pain medication.
There's a question here coming from Module Writers, and Anasema, I was using implant and immediately I removed it. I conceived with triplets. Did it contribute to the outcome?
I've had that question as well before.
Yes,
maybe Doreen, you can help us with that.
Yes, Doreen.
I would say the implant return to fertility is with immediate effect. You do not delay. And for that client, probably they released more than one egg during their first ovulation. So that's why they conceived. They conceived maybe triplets or twins, but there is no direct relationship from removal. You will get a twin pregnancy.
Morning after, P2.
Yes.
If we're talking to the youth, then we know this is a conversation that we need to have. That is the emergency pill. And I remember also when we were talking about the 3 different categories of contraceptions, it wasn't among them. I think intentionally as well.
Yes.
But maybe you can tell us more about the emergency pill.
Yeah. When we talk about the emergency pill, is something that you take to prevent fertilization. Of course, you've already had unprotected sex. Maybe you are not on the safe days, of which even safe days sometimes may change. You can even conceive during your periods because you can ovulate while you're still having your period. So with the emergency contraceptive, the effectiveness depends on the day of your cycle. So sexual intercourse that has happened like maybe 3 to 5 days before your ovulation period, and then you use the emergency contraceptive, most likely it is going to help. But if already you had gone into the ovulatory phase, you've already released the egg, even if you used 3 or 4 P2s, it won't work.
You know, and thank you for that, because Nana, I'm just going to put you on the spot. You just did a post about your sons. What are friends for?
Exactly.
This is it. You just put a post celebrating Iroma, and you said you are on the pill. and or something, you are on the pill or you're using contraceptive
Yes.
or whatever it is you're doing,
Yes.
but you got pregnant at
Yes.
that point. Have you gotten an answer so far?
No,
to
not
exactly
yet.
what
Actually,
happened.
and I'm not the only one.
Yeah.
I've talked to other people.
Many-
They're like,
many
yeah, I was.
people.
And then one that scared me the most was one who said, Auntie, they had the. I think the well, not
The
say which
IUD.
one, because I
Yes.
don't want to spoil business for anyone. And the son came out with that thing over here. And then I'm like, wait a minute. So these things really work, Doreen.
So with the short-term contraceptive,
It was definitely shorter.
yeah. So there's a higher chance of it failing.
Yeah.
Okay.
So when we talk about the daily pill, again, there is that timeline. When we are educating our clients, we usually show them an alarm clock.
Oh.
So we have to keep these levels of the hormone in release at par every 24 hours. So if you take today at 8, tomorrow at 10, definitely you're interrupting.
Yes.
Yeah.
And you will definitely conceive with the contraceptive. But if you're able to put in your timelines timely and avoid missing the pills, it can work.
Does diet also contribute?
Yeah, diet contributes. I've seen people who've gone into dieting and their contraceptives failed, especially the detox,
Yeah.
the intermittent fasting. So there has been a relation between these detoxing and the hormonal imbalance.
Okay.
So when you detox, you deactivate your hormone cycle. So you may end up ovulating even when you're supposed to be safe.
Okay.
So when you're not ready, probably you will end up getting pregnant.
Wow.
Yeah.
Someone says, okay.
Allow
it's
me
okay.
to chime in when it comes to the emergency contraceptives. I know this is a drug that is highly being abused.
Yes.
Every weekend,
Every
I'm
weekend,
sure.
I think the sales
Yes. They go high.
goes higher.
Skyrocket.
But having said that, I think we are forgetting the meaning of the word emergency.
Yeah.
As the name suggests, emergency pills. So until when sex is an emergency, but anyway, it happens as an emergency. But I would like to tell the public that we have done research and we are good enough. Because back then we used to talk about within the first 72 hours,
Yes.
and now it's within the first 120 hours.
Oh.
But the earlier you take it,
the more effective.
the more are the chances of, helping you.
Yeah.
Okay.
The later you take it, now maybe the chances may go low.
Yeah.
And just to add, did the public know that you can as well have the IUD, that is the non-hormonal IUD,
Yes.
being used as an emergency pill?
Huh?
Yeah.
Yeah.
How?
So break it down. How?
So with the IUD, the non-hormonal IUD mechanism of action, it is because it has those copper ions at the stem of that device. So what do the copper ions do? Basically, they are harsh to the sperms and they provide an environment in the intrauterine cavity of the woman hostile for the seeds of the man to survive. Again, it takes up that space. So there is a higher chance within the first 120 hours if inserted, then again there'll be no place for implantation. Again, the sperm will die and whatever was there will come out. And that has nothing to do with an abortion.
Yeah. But then there's also, when it comes to the emergency pill, we have had cases of women having that, what's that, ectopic pregnancies. So maybe you could tell us the importance, if, like, how soon and how many times can you take, are you allowed to take the emergency pill in a year? Because it's really like super less. But then also, what are the e-pill?
So from where I sit, I think the more you take the e-pill, the more you alter your menstrual cycle. So by doing that, at some point, yes, one can do conceive in between. And I wouldn't say that it is because of the P2 or because of the IUD that one gets the ectopic pregnancy. No, there are more other reasons as to why an ectopic pregnancy do occur. But maybe just to again elaborate on the word ectopic, it means a pregnancy that is outside the uterus to another ectopy site. And in this case, we normally refer, the most common example is now the one that happens in the fallopian tube. So it could be the woman is suffering from what we call a PID, pelvic inflammatory diseases. And now the transportation of that egg is not that very likely, so to reach where it is supposed to be. Again, maybe due to other reasons, there is what we call the cilia, the hairy things. In the nose, we have some hair to trap dust. So in those fallopian tubes, we have some hair to propel or rather move the egg towards where it is supposed to be. And in many cases, fertilization takes place in the 3/3 of that tube. So once it happens there, then it has to be propelled slowly to where it is supposed to be. So because of the many reasons that I've talked about, it can decide to stagnate where it is, and that will be an ectopic pregnancy. But unfortunately, that one can't be allowed to go to term. Term here means to develop into a baby, because after maybe 2 months, that tube may rupture or may burst. So the management again will be surgery to remove that, and unfortunately, that affected tube
cannot.
It
cannot work again, right?
That's true. We have giveaways for you courtesy of Mary Stops. As you can see hapa tuko na nini, tunaongea kusema na kutenda. Kuna lifeguard condoms, you have t-shirts for you, black and white, you have notebooks, you have pens for you. All you have to do is tell us at least 3 methods of contraception zenye tumeongelelea hapa. 111 444 111 ndio SMS line yetu. Enda pale kwa YouTube Switch TV, comment down there and let us know in depth what you have learned about contraception today and the 3 methods of that. Nana, there's a question on YouTube. I don't know if you've seen it, from Rosemary Atieno.
Yes, anasema, hey guys, I'm using the hormonal implant, but I'm gaining weight seriously from 80 to 117 kgs. It's 2 years down. It's been 2 years down the line.
With implants and weight gain. So majority of the people who use implants, about 50% have reported weight changes, and we usually say +5 or -5. But the most contributing factor, the hormone being released, might have altered the metabolism of this client if they manage to gain more than 5 kgs.
Does that mean stop and go to another one, or?
High weight gain is associated with high cholesterol levels, and high cholesterol levels, researches have been done, they may cause the implant not even to function well. So I would really advise the client to go back to the facilities and get maybe another option. They can have it removed. But we also advise on dietary management, exercise. So if they are able to follow diet and exercise, probably they could lose. But if they are doing that and they are not losing, I would advise that they go and get an alternative method. That will not
great. Kuna mwingine anasema, a great conversation, anaitwa Irene Elfaz. Great conversation from Mary Stops team. I'm enjoying every moment. I wish this could last a whole day.
Oh, I feel the same.
And then the last one here, I think it's a question, so it might as well. It's a Victor Masharia. Anasema, 1 vasectomy, it's for men where the sperm duct is cut. 2, I think anajibu hiyo swali. Anataka hizi goodies. Ametupatia, I think yes, anasema it's for men where the sperm duct is cut. 2, IUS. These are devices introduced into the uterus to prevent ovulation. And then 3, injectable hormone contraceptives. So I think apewe tu moja hapo.
Ndio hii lifeguard tuko nayo. Kujia nini hapa na sisi yake kuja mingi.
Yeah, and then kuna mwingine anasema dry orgasm, this is new. I'm learning something because I didn't know also. You're not alone.
I didn't know as well.
Yeah.
Kuna question here. My name is Tony. Are there pills for men that are considered as contraceptives. And we've seen a lot. Saa zingine social media, you'll see an uprise of that happening.
Yep.
That there's a new found.
It's
Because
shots.
mimi sijawai ona. So is it true? Is there?
Yeah, allow me to revisit the side effects on implants before coming to
Okay, good.
the
Thank you.
With these side effects, I would like to make it categorically clear that it depends from client to client. I know someone will come talk about the headache, someone will talk about feeling of nauseated, others will talk about cramping on off, but the most common now is the irregularities of the periods. About the weight gain now, it is again from client to client. Why? Because there are those who will talk about weight gain and there are those who will talk about weight loss.
Yes.
So let us not say it is just because of the hormonal method that attributed to the weight gain or the weight loss. It is important for the client maybe to visit a facility for more reviews and we see how best. But I like the idea on checking on the diet. If you see your weight is on the increase, it is important to always check on your diet because of the high cholesterol levels. So
Contraception, your meal, pill.
I wouldn't say there is one for men right now. Why? Because I think it is early this year. There was that conversation that our brothers who are leading in research came up with a pill, and they are somehow testing it, and they say it is effective. What? But as it is of now, from where we sit, we do not have a pill for men, especially in all our outlets here in Kenya, Marie Stops Kenya. We do not have a pill for men, but the research is still on, and we are looking forward
to
have
see.
one.
Yeah.
And,
Waiting to see.
There's also, I don't know if it's still there, but I remember when we were in high school and I think a bit of college, there was conversations around the female condom.
Yeah.
Is it still something that is viable? Are we using it? Is it in the market anymore?
Yeah, it is.
And how do you safely use it? Because there's a way. It's different from just this one.
It is. It can be highly recommended for people who are allergic to latex. Yeah, the mode of insertion is the one that is quite challenging for women to have it. You have to have it inserted at least 30 minutes before coitus or before sexual intercourse, so that it can gain the warmth and adapt to the vaginal walls. But it's a good method that was being advocated, especially for the college girls who are involving themselves in risky behaviors like the bash, the what. So they would be taught on how to use it, because maybe you may get intoxicated, you get raped, but practicability about it, it's quite a challenge, and the uptake is still low.
Okay. So
allow me just to add something.
Yes.
I think we need to understand that they are all called barrier methods.
yes.
And it's not only the female condom, but there are also other types. So apart from the female condoms, we have the male condoms. We also have what we call the diaphragm. It is like a cup.
Oh my God, I remember that from way
diaphragm.
back.
Yes.
Oh my God.
Then apart from the diaphragm, we also used to have the spermicides. These are
Yes,
basically
spermicides.
foamy jelly, like something that are inserted in the birth canal, basically to kill the sperm. But again, we did a research, and it was clear that with the spermicides, there was an increase with the irritation of the birth canal, and by so increasing the chance of maybe STIs. And that is why, again, it is not highly in the market. But with the female condom, I think I challenge the women to embrace that, because you are the ones who take control. I mean, if you have it prior, then I think it is better for us all. And I believe there are men out there who strongly believe if a woman has it, then the man from his end will feel like he is not wearing anything.
So, but then there's last week, it's this week, we were talking about of course sexual, and everything. But first there's the Enlighten Us, there's MSK. I don't know, Avibella. What is that?
Okay.
I'll go back to that question
Yeah,
immediately.
thank you. I'm sure there is another colleague who will come talk about the product that we do have.
Okay.
So Avibella is one of the hormonal IUCDs, that is the intrauterine contraceptive devices. And I talked about the mode of action whereby it makes the cervical mucus thick in a manner that the seeds from the man will not be in a position to go meet the egg. So I know in the market they have that perception that hormonal intrauterine devices is only Mirena. So as Maristops, we have our product and we call it Avibella, which goes at an affordable price. And again, the effectiveness, the quality is more or less like the other hormonal intrauterine devices.
So are they in Maristops alone, or you could get them anywhere else?
Through our many channels, and again, I talked about the commercial sales. So they are the ones that are responsible in distributing it to the many other health networks that we do
Is
work
it the
with.
same with the Lifeguard? Is it also, I can see it's distributed by Maristops.
Yes, so again, Lifeguard is a type of condom. Basically a brand from Maristops Kenya, just to increase more access. And basically, I know someone will come talk about it.
this.
But I can tell people for free that it is one of the best.
Studied for extra pleasure.
Exactly. So for those youth, if they want to chase a smart, especially this weekend, you don't have to look further. It's all about life. I mean, you need to guard your life.
Okay, and our time is up. I know. You are getting comfortable.
STD.
I was like, time. And then I think probably we'll continue this conversation.
Definitely.
I think we'll definitely need to, because there's so much that we haven't. We said to our viewers that we're going to be an hour, but it looks like we need so much more than that.
I think we should actually have another live.
Yes, I think we should definitely have another one to just continue on to that. And there's so many questions that we haven't answered as well. But one thing that you have done is that you have answered our questions, and we have our winners today. Na ulisema mmoja, unajua alitujibu in depth. Anaitwa Victor Masharia. Yes. Victor Masharia, thank you so much for giving us your feedback on that. Emma Salane as well, you're saying tubal ligation for the women, vasectomy for the men, withdrawal, emergency contraceptive. Hizi mbili za mwisho unasikia tumezisema kama others. There are other important ones, but it's still a method. So thank you for tuning in and being very keen. And we have another winner from Facebook. Anaitwa hebu ngoja, ni from Facebook kama ni from winner wa Facebook anaitwaje nini? Nelvin. Ngoja kwa sababu hii nimepata. Emma Salane ndio wa Facebook. So we need one more winner ndio isikakue ni kama tumefanya mavitu huku chini ya maji. So 111 and we'll get in touch with you directly with that information. Thank you so much. Thank you so much, Doreen. This was very informative. We have very
I'm going home to give a whole
lecture. Yes, a whole lecture on this, and we promise to have more of these conversations that are impactful and life-changing. I promised you. I hope umeandika notes. Nilikalisha ule mtoto venye nana alisema kaya hapo chini asikiza, because they are never too young or too old, but they need to learn it from us, from you, the loved ones, the state of the world, teaching them these things. Asanteni sana. You've been amazing. Thank you for the comments. Thank you, our Facebook family, our Instagram family, our YouTube family. Tunawapenda sana. Until next time, from us to you, adios. Okay.
That wasn't good.
Sorry.
Thank you guys. Thank you guys for having us. Indeed, it was a fruitful discussion, and I know you have various questions. And now that we have a toll-free number, that is 0800720005. I repeat, 0800720005. That is a toll-free number, and you can get us through our mushroom facilities here in Nairobi at Samia Business Park, Kangemi, Pangani, Eastleigh, Kenyatta Market, and ICA building. Thank you very much, guys.
Okay, asante pia. Mmesikia namba? Kwaherini.